Okay, so Jane and I are doing a bit of a double act. Okay, so there we are. So, as Rob has already alluded to, this oral history project has been funded by the Heritage Lottery Fund. So thanks to everyone who plays the lottery. And we also received funding from St Stephen's AIDS Trust, so thank you very much to you as well. We started the project over 3 years ago, and this event is the accumulation of all that work that's gone in to bring this project to fruition. So, I think Rob has really highlighted the importance of oral history, and what we wanted to do was that as a group of healthcare workers, and I have to say, although we've been doing the project for about 3 years, we have actually been talking about doing it for about 15, 20 years. And there'll be so many of you in the room where we would be at a conference, glass of wine in hand, going, do you know what, we really should capture our stories. And eventually we've done it. But we felt the time was right now, as we've heard about new effective treatments have come in, and the epidemic is changing and care is changing, but our stories need to be told, and we want people to be able to access them. So we've finished the collection of 61 stories across a range of healthcare disciplines and geographical areas. And as Rob said, these stories will be stored in their entirety in the British Library. So we had a project team of myself, Sian and Jane, and our advisory group of the British Library, and we wanted representation from some of the key HIV associations listed there. The interviewers, within our grant application, we had funding to have experienced oral history interviewers, people who were used to drawing out the best stories from our participants. So huge thanks to them, because the depth and gorgeousness of our stories is down to the interviewers as well as the people telling their stories. We had great support from, as well as the British Library, Michelle, our oral history trainer, who was able to provide support and guidance for us as a project team, as well as support for our volunteers in training them around oral history. And I have to say thank you to the British Library. I'd never been involved in oral histories before. You hadn't either. You had Sian to keep us on the straight and narrow. But actually, working with the British Library, who were there to question us and challenge us a lot of the time, has really aided our decisions to make sure this project is the best it could be. But I must say a huge thank you to all our volunteers. Heritage Lottery are very keen to make sure we include volunteers in the project, so they help us read all 61 transcripts, pick out interesting quotes and stories. They were able to share their experiences with each other. And actually feedback from one of the volunteers was from Claire, who's quite a new nurse to HIV, so she'd missed this period of history. And she wanted to get involved because she said, I want to understand more about the journey that my colleagues have gone through. I want to know more about the stories that my patients and the challenges my patients faced. And by reading some of your stories has helped her, she says, to become a much better nurse and have more empathy. So recruitment, as I say, we had 61 interviews. We got geographical spread, as I said, as much as we could. I think, and we got a good spread of in and outpatient nurse areas, paediatrics, family care, mental health, haemophilia, palliative care, drug use, etc., etc. What was quite interesting for us was the recruitment process. We put calls out through the Nurses Association and the British HIV Association and other related organisations. Very few people came forward to be interviewed. And so actually we used our own networks because between us we can kind of cover most areas. And And people would say, oh, what do you want to hear my story for? I didn't do anything. It's like, that's exactly why we want to hear your story, because you think you didn't do anything. But actually you did make a difference. And then it snowballed, and also people said, oh, I can't remember anything, I won't remember. And then the stories just came flooding out as they reflected on their time. So most interviews were between 3 and 4, sometimes 9 hours, spread over a few days. And I think people got a lot out of taking part. But it was definitely, once people were interviewed, they said, you really must go and talk to my colleague so-and-so that worked in a different area. It snowballed from there. The themes, and Jane is going to touch in a lot more detail about the themes, but they're up there, they're also on all the posters around. We've just touched on 9 themes. We had to keep Sean under control. You might have had 25 posters to be looking at this evening if you'd left Sean to it. But there is so much more work to be done. Stories around people's motivation to go into HIV care, how their young childhood, their life stories actually impacted on why they went into HIV. So watch this space for that. We've done a lot of dissemination already, and of course this event is part of it. We've got a super website, which I hope you will all go and have a look at. And that went live at the end of October. And whilst this is the end of the Heritage Lottery funded project, it is the end of the beginning, and we have lots of ideas of how we continue to use these powerful and inspiring stories. So if anyone wants to join the party, please let us know. Here's just a couple of slides on our website where you can hear more clips and get a more in-depth feel for stories. It also will link you to how to access the catalogue at the British Library. And we have to say a huge thanks to Gideon Mendel, who allowed us to use his photographs for our website and all our other promotional work. But lastly, I have to say thank you to all the participants. Huge thank you for sharing your stories so openly and honestly. Thank you.
You will also hear from the north of England. You will also hear as great detail from nurses, from social workers, from other people who were involved in this epidemic, as well as a sort of rather top-down approach that the professor of HIV medicine might have. And so I think for the future it's very important.
Thank you.